Hello everyone, it's Tuesday, the last day of November, and November the 30th. We've lost an additional 51 folks and everything, and I'll go through those in just one second. But we've been at Wirt County Primary Center and Wirt County Middle School with the great principals of Melissa Emerson and David Tubber. And you know, we were there for round 3 of Baby Dog, Do It for Baby Dog. The school was drawn out of a hat and won $50,000 for the school. It was a lot of fun with the kids, to tell you the truth, and a lot of awareness that we continue to bring. And the General and Secretary Crouch are going to be able to talk to you about numbers in just one second. But let's first and foremost give honor and respect to these people that we lost. The 4,818th person in West Virginia is a 60-year-old female from Raleigh County. The 4,819th death, a 48-year-old male from Nicholas County. The 4,820th death, a 69-year-old male from Kanawha County. The 4,821st death, a 69-year-old male from Preston County. The 4,822nd death, a 53-year-old female from Taylor County. The 4,823rd death, a 55-year-old male from Kanawha County. The 4,824th death, a 74-year-old female from Fayette County. The 4,825th death, a 63-year-old male from Greenbrier County. The 4,826th death, a 64-year-old male from Lincoln County. The 4,827th death, a 72-year-old male from Raleigh County. The 4,828th death, a 49-year-old female from Kanawha County. The 4,829th death, a 64-year-old male from Berkeley County. The 4,830th death, a 54-year-old female from Jefferson County. The 4,831st death in West Virginia is a 97-year-old female from Kanawha County. The 4,832nd death is a 75-year-old male from Logan County. The 4,833rd death, an 88-year-old female from Randolph County. The 4,834th death, a 68-year-old male from Raleigh County. The 4,835th death, a 95-year-old male from Kanawha County. The 4,836th death, a 60-year-old female from Jefferson County. The 4,837th death, an 89-year-old female from Preston County. The 4,838th death, an 85-year-old female from Putnam County. The 4,839th death, a 54-year-old male from Wayne County. The 4,840th death, a 77-year-old male from Mason County. The 4,841st death, a 53-year-old female from Harrison County. The 4,842nd death, a 72-year-old female from Boone County. The 4,843rd death, a 70-year-old female from Harrison County. The 4,844th death, an 83-year-old female from Wood County. The 4,845th death, a 78-year-old male from Fayette County. The 4,846th death, a 70-year-old female from Harrison County. The 4,847th death, a 71-year-old male from Raleigh County. The 4,848th death, a 104-year-old male from Kanawha County. And God bless this man in every way and all these people. The 4,849th death, an 83-year-old male from Kanawha County. The 4,850th death, an 85-year-old male from Marion County. The 4,851st death, a 61-year-old female from Putnam County. The 4,852nd death, a 67-year-old male from Pocahontas County. The 4,853rd death, a 93-year-old female from Pocahontas County. The 4,854th death, an 83-year-old female from Logan County. The 4,855th death, an 84-year-old male from Nicholas County. The 4,856th death, an 80-year-old female from Webster County. The 4,857th death, an 81-year-old male from Preston County. The 4,858th death, a 72-year-old male from Hancock County. The 4,859th death, an 82-year-old male from Marion County. The 4,860th death is a 72-year-old female from Nicholas County. The 4,861st death, a 63-year-old male from Mineral County. The 4,862nd death, a 58-year-old male from Cabell County. The 4,863rd death, a 76-year-old male from Jackson County. The 4,864th death, a 76-year-old female from Marion County. The 4,865th death, a 77-year-old male from Hardy County. The 4,866th death, a 95-year-old male from Berkeley County. The 4,867th death, a 79-year-old female from Harrison County. And the 4,868th death is a 47-year-old female from Wirt County. We were there just a few hours ago. Okay, our active cases are at 5,800, and that's a better number, but we didn't test a lot, but we have 780 new cases, a daily positivity rate of 11.04. Our cumulative rate has jumped all the way to 6.22. We have 284,125 people that have recovered. We have 561 people that are hospitalized and 181 in the ICU units and 96 on ventilators. You'll notice, and there'll be more discussion from Dr. Marsh today in regard to the fact that we went through a surge, the first surge. Hospitalizations raced all the way up into the 800s. And then before we knew it, we got through the surge and they started dropping and dropping and dropping and went all the way down into the 50s. Into the 50s, like 57 were hospitalized. From 850 down to 57, or a number very close to that. Now what's happened is we went all the way to 1,012. And all of a sudden we've come down, but where have we come to? We've come to 500 and some. Today it's 561. Now what does it tell us? It tells us we went to 850, we dropped all the way to 57. Now we've gone to 1,000, we've dropped to 561. And so the bottom line to the whole thing is when we've not dropped very far. We dropped from 850 to 57. We dropped from 1,000 to 561. Now, what is it really just telling us? It tells us that this surge is taking a major toll. And this surge that we're in right now is not cleaning up the hospitals. It's still overloading the hospitals. The $64 question to ask yourself is, what's going to happen? What's going to happen when winter comes? What's going to happen if we actually go into another surge? What's going to happen with the overloading of our hospitals? The bottom line is this. If you don't run to the fire right now and get your booster shots, and you're going to hear some depressing news. You're going to hear that the total number of booster shots has gone way up. Way, way, way up. 222,000 now have received their first booster shot, or their booster shot. 222,000 have received that. But you know what? If you step back from it and just think, of the people that are 65 and older that we've been reporting above 90%, and really now that we've reconciled the numbers, it's a little below 90%. 65 and older. Now think about this. 65 and older, 6 months out from the Pfizer or Moderna booster, or 2 months out from J&J, 65 and older, what would you think? What would you think the percentage of those folks has been that have run and got their booster shot? 31.8%. Honest to Pete. they might as well cock a gun right at their head. Those people, we know without any question that their immune systems now are tremendously reduced from when they got their second vaccine. Those people are exposed beyond belief. And we know if they get this, there's a good chance they die. Now, if that isn't enough bad news, listen to this. For those that have had their first shot, for those that are 50 and older, above 80% have had their first vaccination, and really and truly, 71% of those above 50 are fully vaccinated. Now look, I really don't know what you expect us to do. If you're above 50 years of age and you're fully vaccinated, 71% of you are fully vaccinated today. 71% of you. You know how many of you have gone to get your booster shot? 23.9%. I don't know what to say. I mean, I don't know what to say. If you're over 50 years of age and you made the decision in life to get both your shots, how in the world can you take this level of chance? How in the world can you do that, knowing that if you get this, it is bad stuff, and knowing how infectious this is? General Hoyer and Dr. Marsh are going to talk to you a whole lot more about this in just a few minutes. We've got 3 green counties, 18 red counties, 21 outbreaks in the schools in 17 counties, and 395 cases. I tell you over and over, if you have any symptom and you're 65 years of age and older and you don't go get a test, not smart. If you get the test, we can stop it with the antibodies. If you don't get the test till late in the game, you're in real trouble. As far as face coverings, if you go into a crowd and you're 65 and older and you've got diabetes or lung issues, not smart, just not smart. Like I said, we did, the second week of the grand prize winners at the schools for Baby Dog, Do It for Baby Dog. Again, I say it over and over, she brings a big smile on everybody's face, and she loves everybody. Now, I don't know how in the world you could have a marketing tool that is better than just that. She absolutely makes people smile and loves everybody. And at the end of the day, we can take a lot of knowledge from that in getting through any difficult problem in life. If you can some way muster a smile, it'll be better. And from the standpoint of loving everyone and getting through it, that's what we should do. We also went to Cameron Elementary School this week. Now, Cameron's a long ways away. And from the standpoint of the Cameron Dragons Elementary School and the town of Cameron, I think that it was reported to me the first time in history that a sitting governor, has been to the town of Cameron. Well, not only have I been, but the First Lady's been also. And she went on another occasion, and that was the school right there, and had a great, great day, and I enjoyed it probably as much or more than they did. This new variant out of South Africa, Dr. Marsh or the medical folks are going to talk to you about that. FDA, again, has approved all booster shots for all people 18 years of age and older. We're waiting on the CDC, but I know it's absolute, given that that's going to come, and without any question, we need to be getting those booster shots. If you lost your card, contact us. General, I guess maybe, General, you could come on now and update us on, or give us more information about these vaccine numbers. Are we going to go to that now, Jordan?
General Hoyer, we're not getting any audio. You may be muted.
Yes.
All right.
Yes, sir, Governor. And Jordan, if you could you please put the chart up? So as the governor pointed out, we have, with work of the team from DHHR, they have done a reconciliation of numbers based on entries into the system. As the governor pointed out, it now reflects that we have over 222,000 booster doses in West Virginians. Highlighted 6 blocks in this chart to reinforce points that the governor had made earlier, and a couple of points that I'd like to make. If you look at over 18 population, 68.7% of West Virginians have now decided to take a vaccine, and we continue to see a slight uptick every day in those numbers. So we continue to see West Virginians over 18 taking the vaccination. The challenge, as the governor points out, is if you go and look at over 50 population, both first dose and fully vaccinated, when you drop down to the 50, 71% of West Virginians over age 50 are fully vaccinated. However, if you drop down to that number below that's highlighted in red, only 23.9% of the population over age 50 has received the booster dose. If you look across over at the over 65 population, it's only 31.8% of the 78.7% West Virginians over age 65 who have been fully vaccinated. And then the other number that we would like to highlight is that only 25.2% of West Virginians age 5 to 17 have received a first dose of the vaccine. So again, work done by DHHR to reconcile numbers to make sure that we have the right number of booster doses allocated into the system for West Virginians. But what it continues to show us is West Virginians over age 50 are not taking the booster dose fast enough based on what Dr. Marsh will describe to you related to the challenges that we face. And as the governor also pointed out, why is this so important? We know that over 95% of West Virginians over the age 50 make up the bulk of our hospitalizations and the bulk still of our deaths, even though Delta variant has reduced that to some degree in number, but it's still a significant, over 95% of West Virginians. And we also know that, as the governor pointed out, at the height of the first wave, the first surge, approximately 851 West Virginians in the hospital. As that surge dropped over time, we went down to less than 50 West Virginians in the hospital. In this second surge, over 1,050 West Virginians in the hospital with COVID. And today we are still at 561 West Virginians in the hospital, and a much greater percentage of those in the ICU and on ventilators than we've ever had since we've been dealing with COVID-19. So again, reinforce cleanup of the numbers. Reconciliation gave us a better picture of where we were with boosters, but it is, as the governor pointed out, it is nowhere close to where we West Virginia need to be going into these winter months and what we could potentially encounter with new variant coming forward. So West Virginians, particularly over the age of 50, we have got to get booster doses. We have got to get booster doses quickly. Thank you.
Thank you, General. I guess I'm going to continue on with, just from the standpoint of, our young people, as I've said many, many times, we need the help of our parents and grandparents to get them across the finish line. All the information on COVID is up there on our vaccine line. I've told you about free testing. I continue to thank Frith and Walgreens for all the great work that they've done and continue to do. The long-term care facilities, have 48 outbreaks now. We have 3 outbreaks in our church community in 3 counties, Mineral, Nicholas, and Webster counties. We have a total number of cases of 25 in our church community. Corrections has 43 inmate cases and 12 staff cases. I remind you about taking the flu shot. You can do it at the same time you take your COVID shots and or booster. From the standpoint of our grand families, you're running out of time to apply for this school voucher. That's $150 to all of our grand families for a school voucher. And we titled it, "We're Saving Our Wisdom and Saving, and who are saving our future," and that's the kids and the grand families. So nevertheless, December 15th, we're done with that. From the standpoint of this rental assistance or landlord assistance program, it's available to you. We still have tens of millions of dollars that can go out and go into the economies of West Virginia, in many different ways. If you'll call us, we'll let you know if you qualify or not. I guess there's a big buck photo contest and everything. And hold on just one second. I forgot to give my phone to our people here. And so nevertheless, get this thing turned off. But this year's West Virginia DNR, this year, the West Virginia DNR is holding the first ever Big Buck Photo Contest. It's open until December the 27th, and to enter the contest, take a picture of yourself and the buck that you've harvested during the 2021 season and write a short account of your hunt and upload the photo to the Big Buck Photo Contest entry form that's up online right here. I guess it says myself and Director McDaniel will be judging the entries and awarding all 10 winners. I'm going to take myself out of that, and I don't know how I got into that, but nevertheless, that's what notes are here. And if I could just speak, from my heart to you about hunting and fishing in West Virginia, it'll touch your soul. It's absolutely, it's an experience that you will remember forever. And if you're able to do it with a dad or a granddad, it's something, or grandmom, or mom. It's just something that you'll remember. You'll have the memories. You'll be able to see how beautiful things are. You'll remember that. You'll remember even how things smelled, in the woods, from the standpoint of the crisp air and the cold wind blowing on your face. It's just a spectacular part of growing up in West Virginia, and I hope to goodness that all of you will take advantage. I guess the last thing I have is the flags. The flags will fly at half staff for our former treasurer. John L. Larry Bailey passed away on November the 26th. Larry was elected to the West Virginia House of Delegates representing Lewis County in 1960, and then was elected to serve as the West Virginia treasurer in 1976, serving a total of 4 terms, ending in 1997. In commemoration of his distinguished life and service, I am ordering the United States and West Virginia state flags to fly at half staff tomorrow celebrating this wonderful man's achievements and his service to our great state. And that's all I've got right now. Thank y'all so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. And following up with what the governor talked about and with what General Hoyer talked about, there's really two things that I want to discuss here. So number one is the governor, as we have talked about many times during the pandemic, has tasked this leadership group with two things: saving lives in West Virginia and protecting people's well-being, and also making sure that we have a functioning and able hospital system with the appropriate access and capacity to take care of West Virginians, both with COVID-19 and with other acute medical problems like strokes and heart attacks and car accidents, et cetera. When we look around the country, we see the state of Michigan that is currently seeing more hospitalizations with COVID-19 than they have at any other point in the pandemic. And we look at them as a state that always has gone before us. And as we would sort of use them as a canary in the coal mine, then we can pretty well understand that the risk for us to have more cases coming up during this winter time is almost a certainty. And as we look at Michigan, they have so many hospitalizations that the federal government has started to send them help because they are really the ones that are underwater right now. As we look at our hospital system, as the governor described and General Hoyer as well, we know that we saw a great increase in hospitalizations during the winter surge of 2020, the end of December, to 2021, January. And that peak ended up having, and I'm reading from DHHR website, of 818 people in the hospitals. And over time, we saw that go down. And the first week in July, it went down to 52 people in the hospital with COVID-19. Ventilators went from 219 in that winter peak down to 17, ICU admissions, 219 down to 17, and ventilators went down from 104 to 6. As we saw the Delta variant come upon us, and we saw the most recent surge that we've experienced, which really tested our hospital capacity to the absolute limit, we saw that there was 1,012 people in hospital beds, and that peaked about September 24th. And today we see that we still have 561 people in hospital beds. So comparing to July 2021, where we have 52, we now have 561 people left in hospital beds. For ICU admissions, we had down to 17 ICU people with COVID in West Virginia hospitals. We now still have 181, and got down to 6 people on ventilators, and we still now have 96. So our hospital capacity is very constrained. We know from data from the CDC that if you're 50 to 64 years old and you're not fully vaccinated, and we would say today that is not only 2 shots of Pfizer or Moderna or 1 shot of Johnson & Johnson, but that plus a booster if you're 6 months after your shots of Pfizer, Moderna, or 2 months after Johnson & Johnson, we know that your risk of being hospitalized if you get COVID-19 goes up by 35 times. And we know that if you're over 65, your risk of being hospitalized with COVID-19 goes up 16 times. And even if you're under 50 years old, your risk of being hospitalized with COVID-19, not be fully vaccinated, is up to 15 times higher. So we know that for us to protect our hospitals, to maintain the patient flow, to be able to offer people the best care in West Virginia, we absolutely need to act immediately. As the governor said, run to the fire. And if you haven't been fully vaccinated, get vaccinated. But more importantly, for our older West Virginians who have gotten vaccinated, please go get your booster shot. That is really critical, and not only protecting our hospitals, but protecting you because we know since the vaccine has started that we have seen about 10.5% of our deaths from COVID-19 in West Virginia be in people that have gotten fully vaccinated. And as we look at the age group, 92% of people fully vaccinated who've gotten COVID-19 again, who've died, are over 50 years old. So getting booster shots has worked in every country that has really focused on that. And it will work in West Virginia as well, save lives, protect our hospitals, but we have to make sure that our population is going there. And let me just discuss the second issue. There's a new variant that was initially identified in South Africa called the Omicron variant. And the Omicron variant is a very concerning variant because it has a really large number of mutations. And in fact, over 50 genetic mutations in this variant of the virus. And the fact that it has mutated so heavily that it also has 30 mutations in the spike proteins. And those are the parts of the virus that actually is really critical in infecting us, but also really important targets of our antibody, monoclonal antibody treatment, and also for our vaccines. And there are 3 critical mutations of the 30 mutations in the spike proteins that are really in those areas that our immune system most actively recognizes. So there is some concern that our vaccines and our monoclonal antibody treatments may not be quite as effective. And we know from other studies that that makes boosting even more important. And it's the reason why the CDC just came out and said everybody who is over 18 years old should get booster shots, not may, but should, because of the Omicron variant. And at least in South Africa, it looks like it is out-competing in certain areas the Delta variant, which currently, is about 99.9% of all of the variant cases, the COVID cases in the US is caused by the Delta variant. But the Omicron variant is a completely different kind of virus. It is going to be much more stealthy in trying to evade our immune system. And it is not a variant that has derived from the Delta variant. It's derived from another part of the COVID family tree. And it just tells us that COVID continues to be very capable of mutating. And whether this variant turns out to be one that outcompetes the Delta variant and becomes the most common variant in the United States or in West Virginia, we don't know yet. But what we do know is that COVID remains very active, and it is ultimately important for us to make sure that we are vaccinating all of our population fully. We're boosting the part of our population that is eligible, but particularly for our West Virginians 50 and older, as General Hoyer communicated and as the governor did, so important that you go get vaccinated if you haven't been, and if you have been vaccinated over 6 months ago with Pfizer, Moderna, or 2 months ago with J&J, get your booster. Cannot be more important to really emphasize that too much, because we saw our hospitals get as full as they possibly can. And that was when we had 1,000-bed capacity in our hospitals from the July nadir to the surge that we saw on September 24th. And we no longer have that level of capacity left in our hospital system. Our glass is half full already with COVID patients. And so we only have, from the 561 patients in hospital beds, we probably would have trouble stretching to the 1,012 people that we saw in September. So the time is now for all of us to act very aggressively, protect ourselves, protect our hospitals, and that protects everybody in West Virginia. Thank you.
All right, thank you, Dr. Marsh. Secretary Bill Crouch and Dr. Ayn Amjad are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. Dr. Marsh, I was wondering if you could tell us a little bit about our ability to identify the Omicron variant. We're already actively looking for that, and what signs, the ability to sequence it. Do we have that, and are we actively looking for it currently? Thank you.
Dr. Marsh, please.
Thank you, Governor. Thank you, Charles. Yes, we do have the capability to look for this particular variant, and we are monitoring. We have not identified any case of the Omicron variant in West Virginia, nor has there been any case identified in the United States. The initial observation came from South Africa, but today it was disclosed that a week before the first case was identified in South Africa, there was a positive case in the Netherlands. So we know this variant is likely spread throughout the world, most likely also present in the US, but at a very low frequency. And the key for us is going to be to see where it shows up, how well it competes against the Delta variant, how severe the illness associated with the Omicron variant versus the Delta variant, and also how well our immune systems or our strategies work to continue to maintain our level of care so that we don't overwhelm our hospitals and we don't see people die of a new variant of COVID-19.
All right, thank you, Charles. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members and fellow reporters. Let me frame my question with some statistics here. I know there's been a lot of percentages thrown around today. Let me throw around a couple more because I've been looking at the 7-day trend on the dashboard, and it's very insightful because it's concerning about the oldest people in the population and the youngest. For example, of all the new cases in the last week, 33%, 1 in 3 of the new cases in the past week are among people over age 50, and 21% are people under the age of 20. That's very concerning for both age groups, both extremes of the spectrum. With that in mind, we've made the suggestion in the past, instead of people holding clinics and having the public come to the clinic at the health department, that you take the vaccines to where the people are at. And so we've had clinics at high school football games. I'm wondering if there's going to be a clinic at the Super 6 this weekend in Wheeling. I'm wondering about the possibility of taking clinics to shopping center parking lots or mall parking lots and setting up there because people are out Christmas shopping now. So if you take the vaccines to where the people are at, might we get a better response?
Well, Mark, I'm going to let, Dr. Marsh and General Hoyer, talk about this. I know the last 2 days we've been to Cameron Elementary in Cameron, all the way in the northern part of the state, and we've been to Work County, to the elementary school there as well as the middle school, and we had clinics at both places. And so, for any parents that would want to come, or any parents that would give, their consent to the children and everything. But maybe General Hoyer, you can add to this and everything. It's always good, to have additional thought and ideas.
Yes, sir, Governor. Yes, Mark, and appreciate that thought. And as Governor pointed out, we continue to work with the county level groups that are established and include county health departments, community health clinics, hospitals, and others to move booster clinics to where people are. We have a number of additional clinics being scheduled with businesses to do boosters. So I think you're right. We'll continue to press to move out, as the governor pointed out, and get those out to the population as best we can. But there is no substitute for a West Virginian taking on the responsibility to go get a booster dose, whether it's at a clinic that we put on somewhere convenient or a local pharmacy where they can get those vaccines.
All right, thank you, Mark. Next to David Beard with the Dominion Post.
Hi. Wanted to follow up on the comments about the Omicron variant and the vaccines, because I guess what I've seen and read isn't always consistent, but I gather from what I've seen and heard that we're not 100% sure if the vaccine works on the Omicron. So I wanted to ask, what kind of research is going on to check into that? And do we have an estimate of how soon we might know something about the vaccine's effect on that variant? Thanks.
Dr. Marsh, this has got to be you.
Thank you, Governor, and thank you, David. So there's really several parts to your question, David. So number one is that we know that the booster dose in people that are eligible really greatly amplifies the immune response against COVID-19. And because of the great increase in both antibodies and also what appears to potentially be persistence of response, then most people, experts and vaccine manufacturers do believe that there will be residual benefit to people that have been fully vaccinated and boosted to the Omicron variant, just like we saw with the Delta variant, et cetera. We also, though, know that some of the targeted immune modifiers, like the monoclonal antibody treatment that are directed against very specific parts of the spike proteins, may not work as well. And Regeneron just came out this morning and said that they found that their monoclonal antibody cocktail did not work as well in some very early testing. And it also appears that the vaccine manufacturers, Moderna and Pfizer, are now actively working on modifying their vaccines in case there's the need to have a more targeted vaccine booster for the Omicron variant. And so in the next 2 weeks or so, we will find laboratories from around the world, CDC, vaccine manufacturers will all be doing studies to look at how much of the antibodies that are produced by both the primary and secondary vaccines, the first and second doses of Pfizer, Moderna, and the first dose of Johnson & Johnson, and the boosted levels of antibodies from the booster doses, and neutralizing, blocking the ability of the Omicron variant to cause infection. And as those studies come out, we will have a much better idea about what the true efficacy, the true efficiency, the binding, the neutralization for these antibodies to the Omicron variant. And I think at that point, we will have more insight on whether or not, if the Omicron variant does become a dominant variant, of what strategies we should take. It's also important to recognize that there's more parts to the immune system from vaccination and from getting infected and having native immunity to help us fight off COVID-19. So the antibodies are certainly one part, but there's another group of modifiers called T cells that can work independent of the antibodies. So having vaccination will help protect people to some level. The question is, at what level will the protection be maintained? And at what level will the new variant cause a more challenge to people's immune system? And that's what we'll learn, I believe, in the next 2 weeks or so.
All right, thank you, David. Next, we'll go to Kenny Bass with WCHS and Fox 11.
I know you've spent a lot of time already talking about the Omicron variant, but with people seeing it in the news and now the discussions being centered on it, there are two schools of thought. One is, here come the fear police with yet another thing to try to scare us into taking a vaccine that we don't want. And then two, the other camp, which says, we've done everything we can do to protect ourselves. We've gotten the vaccine and we've taken the booster, and now there's an unknown that may threaten us or our families. So what level of concern should we be at today? And what level of concern should we be at as we move forward? What are the realities surrounding this thing, besides the opinions that are being formed about maybe your opinions of the vaccine itself from the two different camps which have formed around the subject since the start of the pandemic? How much should we really be concerned, and how much is there a little fear theater being put out there, or hyperbole from maybe national news networks and news media looking for a hook? Thank you.
Well, let me take this, okay? And I've just made myself more notes, as we've gone forward here, and I was going to, wrap this thing up with just this. But I think this is appropriate to do it right now. Kenny, I think you're splitting the bullseye. I think really when it really boils right down to it, there's been, especially from the federal government, but there's been so many conflicting reports that people don't know what to believe. But I can tell you this, that from my standpoint, from the experts that are with me and from their standpoint, we are not alarmist. We are absolutely going to tell you the facts the very best we possibly can. We're going to be transparent. We have been all along. We've told you the truth, have we not? Now, in watching the political moves and the television and listening to the social media and all that kind of stuff with everybody on their soapbox, it's really, really hard to filter your way through and come up with the right direction to go. Let me just tell you just this, and here's the right direction. I will promise you this is exactly right. These vaccines, and I don't know why the United States government has not told us this already. Maybe I'm the first one that's screaming it to the top of the highest hills. These vaccines, we now know, are nothing more than a bridge that buys us some time. That's all they really do, buy us time. In order for the superstars, the really smart people, the scientists, the medical field, to come up with an absolute solution to stop this. That's all they are. That's all they are. They're a bridge to buy us a little bit of time. A little bit of time to where in that time we're protected at a pretty dadgum high level. We're protected. And through that time, then we're waiting for someone to really give us the answer and the solution. Now, through that time, we watch people die over and over and over. And we watch people get terribly, terribly sick. And we watch maybe our young people carry side effects throughout their life. Now, absolutely, when I come on here and I look right in that camera, I'm going to tell you the truth. I'm not going to cry wolf. I'm going to tell you the truth. I tell you over and over and over that I'm respectful in every way of our freedoms in this country and will stand by that till the cows come home. But I also tell you every day that absolutely not getting vaccinated, to me, is not the smart thing to be doing. We should be respectful of one another and we should love one another with all in us. That's what has made America as great as we are. But in this situation right here, if we don't get more and more and more people vaccinated, there's more people going to die. Now, let me just say just this. And I want you to really dial into what I'm saying because I can make it so simple. It is absolutely just simple, as I always say, simple as mud. This is all there is to it. If you make a decision, and a bunch of people have, think about it. 23.9% of the folks that are 50 and older have gotten their booster shot. Now, I don't know anything that it would be any more ill-advised than to just not get your booster shot. You have already been fully vaccinated, and you are absolutely sitting on your hands and not getting your booster shot. Without any question, you mark it down. You mark it down that your governor and your friend, Jim Justice, is telling you this. A bunch more of you are going to die. That's all there is to it. Any way you cut it, you just might as well line up. A bunch more of you are going to die. Now, with that, I would just say this. If you don't get that booster shot or you don't get yourself vaccinated, you're going to overload our hospitals and you're going to cause a bunch of people that have heart attacks or strokes to die too. You're going to overload our hospitals without any question because it will get colder and this will get worse. I don't know how to make it any simpler than to say just this. At 23% of the people that are 50 and older, if that's all we've got with booster shots today, a bunch of you are going to die. And on top of that, a bunch of you are going to overload the hospitals and cause even more people to die. And the last thing I would say is to absolutely all that we know, tell me one horror story of somebody that's been vaccinated. Tell me one. I have not heard one that's a personal story that I know. Now, I know just as well as I'm sitting out there that there are folks that have been vaccinated that have had problems. I get that. I get it. But what I'm trying to illustrate to you is just this. If you don't get that booster shot, a bunch of you are going to die. And without any doubt, if you don't get that booster shot right now, you're going to overload our hospitals, and that's going to cause more people to die that don't even have COVID or do not have any level of this variant. Without any question whatsoever, I can honestly say almost zero of the folks that are vaccinated or getting their boosters, almost 0% of those folks have horror stories to talk about. Now, it's just as simple, like I said, it's as simple as mud. We have got to get vaccinated. And for God's sakes alive, if you've not gotten your booster shot, you've got to go get your booster shot. And you've got to really hurry. That's all there is to it. You've got to really, really hurry right now. Mark Curtis has come up with some wonderful ideas. The robocall idea and everything has helped. There's no question. And in this today, he says, what about clinics? What about doing things at shopping malls? Or what about doing things at ball games or whatever it may be? It's all a good idea. But absolutely the power of television, the power of any level of media, any level, newspaper, radio, television, whatever it may be, social media, the power of that is absolutely how we get the word to the people. Or we go just like we did today. We go to the people. And from the standpoint of the media, I need you to help me. I need you to help me to get word to the people of just what I just said. Without any question, if you're 50 and above, especially 50 and above, and you don't get your booster shots, a bunch of you are going to die. And without any question whatsoever, if you're 50 and above and you don't get that booster shot, we're going to overload our hospitals. And if we overload our hospitals, then a bunch of people that are trying to get into the hospital because of something that's happened to them, a car wreck, a stroke, a heart attack, whatever, are going to die because we are overloaded at the hospital. And the last thing is almost zero horror stories have come from people that are vaccinated. Absolutely, this vaccination stuff is something that we absolutely have to do to buy us some time. I can't make any more blunt, any more simpler than that.
All right, thank you, Kenny. Next, we'll go to Paul Mullen with WCBC.
Thank you, Jordan. Good afternoon, Governor. Good afternoon, everyone. Governor, we put our heads together in the fall and we're a bit amazed that the virus did not spread when we had 100,000 or more people show up at a football game and yell their heads off. And we're about ready to go into basketball season where you have a lot of crowds congregating together. The fact that these gymnasiums, and if you want to go to churches, okay, you can go there too. They have high ceilings. Does that prevent some of the spread of this? I'd like to hear from our experts on that. And if there's nothing to that, are there any plans for limiting crowd size, requiring social distancing, and the things that we went through last year? Thank you.
Paul, I'll comment on the back end. There's no plans right now to limit the crowds, and there's no plans right now to go back to social distancing and all that. And I hope to goodness that we don't have to do that. You know, I'm not anywhere close to an expert enough to comment on the high ceilings and everything. The only other thing that I would tell you, Paul, is just this: we have seen that outdoors gatherings of big numbers, you know, 60,000, 100,000, it may 100,000 plus at the Michigan-Ohio State game and everything. We have not seen, we've not been just overrun with cases. But Paul, is what we're seeing, is that good? I mean, the $64 question is that good enough? Is this just a way of life? Is right there 51 names, 51 people. Is it just going to be, that's just the way it is? And you know, you spin the dial, every day you get up, you spin the dial, and who knows? Could be one of the 51. Are we just going to do that and just say that's good enough? You know, I am a firm believer we don't need to be shutting down anything. But we have a methodology here to keep everything open and win the game. And the methodology is the booster shots, the vaccinations. We can keep everything open. We can have our cake and eat it 2 times a million. We can absolutely keep everything open and win the game. Or we can continue down this path. I don't see as much of a choice. But anyway, as far as the high ceilings, somebody else answer that. I can't do that one.
Do you want to take this one?
Sure, I can answer that. Paul, the height of the ceiling doesn't make much of a difference because it's still an indoor space. When I think of someone having a respiratory virus and aerosolizing that, you know, it's more the distance. That's why the 6 feet distance is important when we're talking about indoor space, but I don't consider the height of a ceiling making much of an impact. So your question, if someone is in a gymnasium versus a church, it's still an indoor space. So we still consider, you know, being masked or being vaccinated or keeping that social distance being the most mitigating efforts that you can have. But I don't know if Clay wants to add anything to that.
Nope. Sounds good, Ian. Thanks.
Thank you, Paul. Next, we'll go to Mark Cram with WDVM.
Good afternoon, Governor. Good afternoon to everyone. Again, your valuable time is so well appreciated. Hearing about the Omicron variant, it's got variants obviously on people's minds again. Where most likely is a variant going to occur? Is that in an unvaccinated person? And does it occur in a vaccinated person that it's responding to some different science there? I know that's probably a pretty deep question, but I know our experts can shed some light on that. Thank you so much.
Mark, thank you a bunch. And Clay, that's got to be you.
Thank you, Governor, and thank you, Mark. So the Omicron variant is actually very, very interesting from the point of view of your question. So that we know that many of these variants are coming from people who are immunocompromised and who are getting treated with active, say, antibody therapy. And that has been the thought when we see these more unusual mutants that come forward, because the implication is that they've had a chance to replicate a number of different life cycles and acquire all of these mutations because they're pressured by the treatment, but they're not taken care of by the host immune system. For this particular virus, the other possibility, so one possibility is that this may have really come to light within being infecting people or a person who is really very immunocompromised. But the other possibility, which people are talking about more and more, is we know that what is starting to happen is that COVID initially in Wuhan, China, came from a bat to a person. We know now that people have spread it back to animal sources. So there was a study in Iowa that looked at white-tailed deer, and about 30% of those tested in Iowa during a period of time were positive for COVID-19. And looking at antibodies, a higher percent had been infected, at least that was the thought. And we know now that cats and leopards and raccoons and mice have also been infected. And so there's a thought, because of the incredible number of mutations in this virus, that the Omicron variant may have jumped from people back to animals and now maybe back to people, or maybe another form of the COVID virus that really got its weathering and was really created in an animal source and then came back to people. So I think that as we go forward, whether it came in an immunocompromised person or jumped back from animals to people, we know that this COVID virus is not done in trying to become more fit. And because of that, it really, as the governor has said many times and said today, that it should really be all of us running to the fire to make sure that we are protected as well as possible to try to keep this virus from continuing to mutate even into worse forms that may threaten us even more.
All right, thank you, Mark. Governor, I'll turn it back to you.
Well, I could go back through this again. There's no need in doing that. I would just, I'd tell all West Virginians, I love you. I love you with all my soul, and I mean it. You know, I don't blow smoke at anybody about anything. I don't have time for it in my life. I could not be more sincere or more truthful than what I've already told you. And if you missed it, then go back and please, you know, replay it to yourself or replay it to others. But this is serious stuff. Really, really, really serious stuff. And we've got a way out. We've got a pathway out. And the pathway is harmless for the most part. For all we know, harmless. We got a way out. And a way to not have to suffer through social distancing and limiting on crowds and shutting businesses down and doing what we did to our bars and our restaurants and all those folks, you know, our hair salons and barbershops, all the different people that, you know, that we just made it so tough, you know. Now, we got a way out. That's all I got.